A 5-6-year-old man walked into my clinic one quiet afternoon, calm and unbothered. He smiled politely and sat down as if nothing serious was happening inside his body. He told me he had been feeling slightly tired for a few months. Not extreme fatigue, just a subtle loss of energy that he could not explain. He said, "Doctor, I think it is just age catching up with me." He was still working every day. He was still managing his responsibilities. From the outside, his life looked completely normal. There were no dramatic symptoms, no pain, no warning signs that would make someone panic. But when I reviewed his reports, something immediately stood out. He had fatty liver. I explained it to him slowly and clearly. But he smiled and said something I hear very often. "Doctor, I do not drink alcohol, so this cannot be serious." He believed that fatty liver only happens to people who drink heavily. He believed he was safe. And that belief is exactly where the danger begins. 3 months later, his life changed suddenly. He was rushed into the emergency room with severe chest pain. Sweating, breathlessness, fear filled the room within minutes. It was a heart attack. If you are still watching, type 1 in the comments so I know you are paying attention. What shocked his family was not just the emergency. It was the connection they never expected. No one connected his fatty liver to his heart attack. Not even him. He thought his liver condition was minor, something that could be ignored. But the truth is far more serious. And it is happening to millions of people quietly. It was something he had been doing every day without realizing the damage. My name is Dr. Rajesh Kumar. I have spent more than 20 years treating patients with liver and metabolic diseases. And today, I want you to understand something that could change your life. Fatty liver is not just a liver problem. It is a silent signal that your entire body is under metabolic stress. Most people believe the biggest danger of fatty liver is liver failure. But that is not what usually takes lives. The real danger comes much earlier, and it comes silently. Heart attacks, brain strokes, type 2 diabetes. These are the real threats connected to fatty liver disease. Let me explain this step by step in a way that is simple and clear. Fatty liver develops when excess fat starts building up inside your liver cells. This can happen even if you do not consume alcohol. This condition is called non-alcoholic fatty liver disease. Today, it is one of the fastest growing health problems in the world. In many cities, nearly 1 in 3 adults may already have fatty liver, and most of them are completely unaware. Because in the early stages, the disease is silent. You may feel normal. You may look healthy. You may continue your daily routine without concern. But inside your body, a slow and silent process has already begun. The fat inside your liver starts irritating the liver cells. This irritation leads to inflammation. This stage is called steatohepatitis. Over time, this inflammation damages the liver tissue. It creates scar tissue. And if this process continues, it can lead to cirrhosis. A stage where the liver becomes permanently damaged. If you are still here, comment 1 below. This shows you truly care about your health. Because what comes next is something many people ignore. Now here is the most important truth. Most people with fatty liver do not die from liver failure. They die much earlier from metabolic complications. This is something many people do not realize. And even some doctors may overlook this connection. People with fatty liver are 2 to 3 times more likely to develop serious conditions, heart disease, stroke, diabetes, high blood pressure. All of these are part of what we call metabolic syndrome. Fatty liver is not an isolated condition. It is a warning sign that your entire metabolic system is struggling. Think of it as the first alarm bell. Your body is trying to tell you that something deeper is wrong. Even if you feel healthy today, your risk may already be increasing. And here is something even more surprising. You do not need to be overweight to have fatty liver. In my clinical practice, I have seen many patients who look slim, but inside their organs are storing excess fat. This is sometimes called hidden fat. You may look healthy outside, but inside your metabolism is under stress. Now let us understand why this happens. One of the main causes is diet. A diet high in refined carbohydrates and sugar. Foods like white rice, sweets, bakery products, packaged snacks, and sugary drinks. These foods increase blood sugar very quickly. When your body cannot use all that sugar, it converts it into fat, and that fat gets stored in your liver. Another major factor is lack of physical activity. Long hours of sitting, minimal movement throughout the day, your body burns less energy. So the extra energy is stored as fat, especially around your abdomen. Belly fat is strongly linked to fatty liver. There is also something called insulin resistance. This is a key driver of fatty liver. When your body becomes resistant to insulin, your blood sugar stays high. Over time, this leads to prediabetes and eventually diabetes. At the same time, your cholesterol levels begin to change. Triglycerides increase. Good cholesterol decreases. This creates a dangerous internal environment. Now let us connect this to your heart. Fatty liver is not just storing fat. It is actively releasing inflammatory chemicals into your bloodstream. These chemicals travel throughout your body. They damage the inner lining of your blood vessels. Over time, fat begins to build up inside your arteries. This process is called atherosclerosis. The arteries become narrow. Blood flow becomes restricted, and one day a blockage can occur suddenly. That is when a heart attack happens or a stroke. This is why fatty liver is so dangerous, because the damage is silent. It builds slowly and it affects multiple organs at the same time. Your liver, your heart, your brain, your pancreas, everything is connected. Let me share another real example. A 55-year-old woman came for a routine health check. She had no major complaints, just mild fatigue and occasional sleep disturbances. Her weight was normal. She did not appear unhealthy, but her scan showed fatty liver. Her blood test revealed early insulin resistance. Her triglycerides were high. Her good cholesterol was low. She was shocked. She said, "Doctor, I am not overweight. How can this happen?" But this is the reality many people do not understand. Fatty liver does not only affect overweight individuals, it can affect anyone with poor metabolic health. After following simple lifestyle changes for 6 months, her condition improved. Her liver fat reduced. Her blood markers returned to normal. This shows something very important. Fatty liver is reversible, but only if you act early. Now let me tell you some warning signs you should never ignore. Constant fatigue, even after proper rest. Unexplained weight gain, especially around the abdomen. A feeling of heaviness in the upper right side of your abdomen. Dark patches on your neck or underarms. Abnormal blood sugar or cholesterol levels. These signs may seem mild, but they are early warnings. Your body is trying to protect you. But many people ignore these signs because they are busy, because they feel it is not serious, because they believe it will go away on its own. This is where the real risk begins. There is also a psychological aspect to this condition. Many people ignore early symptoms because they feel fine. Some delay action because of stress or busy schedules. Others feel confused and do not know where to begin. But the truth is simple. Small changes can create powerful results. You do not need extreme diets. You do not need complicated routines. Start with simple habits. Walk for at least 30 minutes every day. Reduce sugar and processed foods. Eat more vegetables and whole foods. Sleep well and manage stress. These small steps can slowly reverse fatty liver, especially for people above the age of 50. These habits are essential. Your body still has the ability to heal, but only if you support it. Think of your liver as a silent worker. It works every day without complaint. It filters toxins, it processes nutrients, it supports digestion, but when it starts storing fat, it is asking for help. And if you ignore that signal, other organs will suffer. Your heart may be affected first. Your brain may follow. Your pancreas may struggle to control sugar. This is not just about one organ. This is about your entire system. And this is why fatty liver should never be ignored. It is not just a condition. It is a warning, a chance to act before something serious happens. Take a moment and reflect on your daily habits. What you eat, how much you move, how well you sleep. how you manage stress. These small choices shape your future health. They determine whether fatty liver becomes reversible or whether it leads to something life-threatening. And remember this, your body often whispers before it screams. Fatty liver is one of those whispers. Do not wait for a crisis to take action, because by the time symptoms become obvious, damage may already be advanced. Listen early, act early, protect your future. If you found this helpful, comment 1 and make a simple promise to take better care of your health starting today. Stay tuned for the next video where we will discuss silent inflammation and early warning signs of liver health. You can learn more by following this channel for simple and reliable health guidance. This information is meant to guide you, not replace your doctor. Please seek medical advice if needed. Thank you.